earthquake shook Nepal, causing widespread destruction. At least 7,300 are believed to be dead and thousands more are injured. As rescuers continue to search for survivors, efforts to help those who have lost everything continue. And if you're sitting at home wondering how you can help, well, we have one option. It's called Operation Walk Chicago. Dr. Ravi, Bashyal, a surgeon with North Shore Orthopedic Institute and an Operation Walk Chicago volunteer, joins us now. And Doctor, thank you very much for coming. I really appreciate it.
Thanks for having me. I really appreciate it.
Tell us a little bit about this organization and what you do.
Sure. Operation Walk has been established for about 10 years now, and we have a very close relationship with the Nepal Orthopedic Hospital, and we've been going there for years now to provide orthopedic care that wasn't otherwise available in Nepal. With the tragedy that's just been happening the past 10 days, we've been able to mobilize to try to help with medical relief efforts, specifically within the field of orthopedic surgery in Kathmandu.
So what are they telling you there, the folks that you work with, as to their needs and how extensive the problems are? We hear about it, we see these pictures, it's beyond belief.
Well, it's constantly evolving. You know, initially, in the initial few days after the earthquake, the goals were search and rescue and to really get relief and supplies there, financing, support to run the hospitals. Now we've gotten to a stage where most of the search and rescue has died down, and we're working on stabilizing orthopedic injuries. The next couple phases will involve treating those injuries definitively in the months to come, and then we have long-term plans to help deal with the rehabilitation needs of the country and the people due to the sequela of the many injuries that we will see and have seen already over the past 9 or 10 days.
Dr. Bashyal, this tragedy affects you in a personal way. This is where your father grew up, and you have relatives still who live in this country, right?
Yeah, that's correct. I grew up here in Chicago, and my father has always been very involved with the Nepali community, and throughout my life I've had a chance to interact with that community. My fiance's family is from Nepal, so we have a lot of family that is there, and certainly it has impacted us personally. The inspiring thing really has been the ability of the Nepali people to rise to the occasion and to really help their fellow man. These are people, that a lot of them, that didn't have a lot to begin with. You add the tragedy in, and they're still coming together to really help each other and make a huge difference in the overall outcome.
Right, and I guess that's what's so impactful when you look at it. This is a country that already was struggling, and now this. And I guess, you know, how can we help? What's a way the average guy at home, anybody who's watching right now, to reach out and try to make a little bit of a difference in trying to rebuild this country?
As I said, the people are really rising to the occasion, but they need our support, and the best way that we can help now is by supporting funding. Our website, OperationWalkChicago.com, does have a link to help donate. These donations go directly to the Nepal Orthopedic Hospital. On our end, we are sending a team tomorrow actually to begin with the second phase of stabilizing the traumatic injuries, and we have plans to subsequently send other teams over the next several months to definitively treat these injuries.
It's fantastic. Tell me quickly, the team that you send, how many people, what does it look like, what's the deal?
It depends on the phase. Our first phase, again, here is to stabilize the acute injuries. There'll be 2 orthopedic trauma surgeons that are traveling, as well as an anesthesiologist, a scrub tech, and some nursing staff. So professional staff. We're trying to limit our numbers so we're not consuming resources, but able to provide an impact. And in the months to come, folks like myself that do hip and knee replacement, joint reconstruction, will be going to treat the injuries that kind of have been stabilized but need further treatment for lifelong abilities and for people to be able to mobilize again.
Doctor, keep up the great work. We really appreciate you coming and sharing this information with us.
Thank you very much for having me. I really appreciate it. Thank you.
All the best to you.
Thank you very much.
Hey, Mark, how about that?
Hey, Doctor, I want to